So, this presentation is intended to give an idea of our resilient community planning framework, and in reality, it's starting to think about how communities can rethink about themselves. But I'll start a little bit by asking a question to everybody in the audience today. Where were you 20 years ago? What was the world like 20 years ago? Where were you inhabiting, and what was the world like? And what I want to talk about is there's really an elephant in the room that we're often trying not to address. But 20 years ago, the population of the world was 6 million people. We're closing in on 7. 20 years ago, we were almost living within our means, and today we require a planet and a half to supply our demand. 20 years ago, we were mostly an rural population. Today we're mostly an urban population. 20 years ago, global refugees were half of what it is today. The extent of global refugees has more than doubled. A lot of them are actually environmental refugees, but the fall of the Berlin Wall has absolutely changed things. Childhood obesity has also doubled in the last 20 years. So just think about how your life was 20 years ago. Today, children are twice as likely as being obese. Food cost in the production and consumption of food has more than doubled in the last 20 years. So has congestion. If you live in a city, any major city, congestion has doubled in the last 20 years. The number of catastrophic weather events has also increased exponentially, and this is in that 2-decade period. For people to be reminded, in the last 6 months, Calgary has been flooded, Toronto, Fort McMurray, Winnipeg. We've seen tremendous amount of events taking place. And that's that elephant in the room. We're often in a position of not wanting to address these things, not looking at them squarely in the eye and trying to understand what it's all about. And it's easier often to take on an attitude of, I can't do anything about it. It's not what I'm all about. I can't engage this, so I need to step back. And the end of near is often we end up pushing these things off. So entirely, what we need to be doing, and this is the presentation today, is how can we start to think about these things, break them out, and start to create a framework to do that. And what we find often is there is a real cognitive dissonance where we know a lot of these things, but we don't want to address them, and we just park them off to the side. So the presentation today is much about what is community resilience planning, who is it for, how is it done, and where is it done. And there's 3 slides in there that are very detailed in a methodology, and you probably want a coffee for those 3 slides. But in between those, I'll present a little bit more of broader sense. So who is it for, and what is it all about? There's a fairly common understanding that resilience is about preventing and protecting from hazards such as floods and hurricanes. And I think that, generally speaking, that's what the majority of the population understands resilience to be. And you probably will recognize that in yourself. This is what resilience is. In fact, I'm here to say that's not what it is. There's a much broader understanding that we can start to think about. A lot of people think that resilience is about designing buildings and structures to be robust and durable. That also is not what it is. It's way more than that. It's also not the capability to just live off the grid and be free of external things happening around you. And it's not either a real, just kind of an extension of ideas of sustainability influenced by military engineering. It's much, much more than that. And I will have a definition for you later. But there's some significant shifts in how we can understand resilience and how we can understand what it is that we do about it. The first thing is it has to be about people. It's not about buildings, it's not about dams, it's not about infrastructure. Those are the means to the end. We need to refocus resilience around people. We need to refocus it around who it is that we're doing this for. So there's a big, huge shift in what constitutes and what ought to constitute resilience. The next big shift is, well, certainly us understanding who are the folks in our communities, in our organizations, in our society that are going to be the most vulnerable. this is where resilience can really start to get strategic. And often is a city will define the resilience based on trying to protect from a flood. If we shift that around and we focus around what is a elderly, infirm, low-income woman going to be doing in the context of an event, and how can we start to refocus what we do around that? The second big shift in terms of what constitutes resilience is there's been a tremendous amount of thinking on two very separate camps. The operational resilience, how does a hospital, how does emergency services, how does a police infrastructure recover from an event? And on the other hand, at the global scale, the global warming, how do we, as a world population, start to rethink about resilience? Well, we've attempted to connect these two dots, actually take operational resilience and the thinking in it and expand that to understand community resilience. And there's a tremendous body of methodology in operational resilience that we've expanded and been extremely technical around that. The third big shift in what constitutes resilience, most people focus on the big one-day catastrophic events, the flood, the bomb, the big event. And we believe that in order to be resilient, we need to be thinking about those stresses, those things that over time can become a shock. But arguably, for example, Detroit did not fail based on a big shock. It was the death of 1,000 cuts. It was a whole series of things that took place over time that stressed the environment, and it wasn't resilient about it. So shifts in the economy, shifts in demographics, shifts in technology, world population, all of those things are, over time, constitute a tremendous stress into any community, and we need to be thinking about that. The fourth big shift in what constitutes resilience, or resilience planning, is not just focusing on the prevention, on what happens before an event, building the bigger dam, but actually what happens afterwards. How do you recover? How do you come out of it stronger and better? How do you adapt at the other end? And in many cases, the flood may come, but if you have an ability to deal with it, and you have an ability to recover from it and adapt to it, then you will be resilient. You're not going to be preventing change. In fact, resilience is not about preventing change, it's about managing change, and what do you do with that? So lastly, what big shift is to rethink what constitutes failure. Getting flooded is not necessarily failure. Loss of life, loss of operations, loss of data for an office, that may constitute failure. So every community, every organization has to look at itself carefully and understand what constitutes failure. Failure for a hospital is going to be very different than failure for an office space or for a neighborhood. And that's the big critical part. So we've started to map out what happens in any incident. What happens when you're trying to face any change. So you'll have a routine operation, you'll be performing at a certain level, then something happens, a shock, but this could be a stress and it just gets stretched out. And over time you have a period of reaction, you have a period of responding to things. Later you have a longer period which is about recovering to that, and hopefully and eventually you gain back to a position of routine. The interesting questions to ask for us in all of this is, what's your minimum capacity to operate? What are those things that you need to be able to be in place in order to be able to quickly react to things? But more interestingly is then, what is your operational continuity requirements? What do you need in order to have in place to continue to operate whatever your sense of purpose is? So again, for a hospital, their operational continuity may entail not losing power for 5 minutes. For an office or for a community, downtime can actually be a couple of days. But loss of life, loss of information, that is what constitutes failure, and those are the things that we need to be talking about continuity. So our definition of resilience is more about the ability to creatively and collaboratively adapt, respond, and recover to change. And there's some key words in all of that. The creatively entails using the resources that we have available and being entirely tailored and nuanced to the conditions of any given environment. Collaboratively, because this is not something that can be done top-down. In fact, it's something that we need to do as a community, as an organization, as a group of people. And it's about all those different stages. How do we adapt to things even before they happen, after they happen, but also how do we deal with the things in the aftermath of any particular event? So how is it done? And this is where it starts to get a little bit meaty in all of this, but ultimately it's an ongoing cycle. In order to have a community that is resilient, we need to be constantly evaluating who we are, what are the potential failures that we can face, how do we start to plan and adapt for those things. Then when something happens, be it a shock or a stress, how do we actually start to respond and recover, and then again review and adapt, and this is an ongoing cycle. And I'm going to deal mostly with the top part of that, which is the planning component, but it is an ongoing implementation as well, and we constantly need to be implementing it. So the first part, which is really planning, and this is where we've brought a lot of the operational resilience methodologies and the community planning methodologies together and have started to work on this front. And they're things that you will recognize in many of the processes that you probably are doing yourself, and even in your daily life. You start by trying to define what it is that you're looking at. Then you start to do some self-reflection, some evaluation, some discovery. Then you start to develop some priorities and strategies, and eventually a plan, and you start to implement that. It starts to get really interesting right off the bat. If we really need to understand what it is that we're looking at, we also need to understand the context within which that is taking place. So if we're looking at an operation, where is that taking place? What are the areas of influence that affects? And importantly, we need to be working on two parallel streams. First one is about what do we want? We need to start by really identifying where do we want to be 10, 20, 100 years from now. But we also need to be asking, where are we at? And it's only by asking those two questions that we'll later be able to create a roadmap to fill the space between those two, to go from where we're at to where do we want to be. And there's two parallel areas of streams. So on the one hand, first we have to be asking the vision. What's that vision? And when we ask that vision, then we can start to ask, well, what does that vision depend upon? And this is an exercise in dependencies, because when you want to look at your weaknesses, you want to understand where those dependencies exist. And we have the ability to really model this and add a tremendous amount of detail through software around understanding dependencies. In a similar way, when we understand where we're at, you want to understand, based on a whole series of indicators, do a health check. How's the community doing? How's your food supply doing? How's energy? How's water? What are the different things that you need to be looking at to understand where those areas of, again, dependency may be? So by bringing those two things together, we can really understand where our strengths, where our weaknesses are, and where are areas of priority. So by the time that we get to doing an actual plan, it's not a comprehensive plan that's going to deal with everything. It's a strategic plan that is going to allow us to focus very directly around those areas that most matter and how we're going to create the biggest bang for the buck. And I'll show you an example of doing this in a minute. But then that's going to lead us into the implementation side of things. So key elements in all of this, what do we need to be looking at? Well, we need to be looking at our people. We need to be looking at our infrastructure and our ecosystems, and also our organizational capacity. And this is where it starts to get really detailed, because we've developed a whole series of different indicators that give you a good sense of that health of that environment that you're starting to tackle. And inevitably, you need to identify where the red flags are and start drilling deeper and deeper. But we also need to be thinking about what are some of those attributes of resilience? What are some of those goals and that values that we want to start to evaluate those indicators based upon? So first, we need to be thinking about the redundancy, the diversity, the flexibility, and the adaptability that may exist on any one of those indicators. So is your food supply redundant and diverse and adaptable? Is your some of your health indicators? How's your demographics doing? How's your economy doing? We also then need to be, well, this is going to allow us to do our dependency management. We need to be looking at some of the key performance relative to physical space. Are they clustered together? Are they isolated? Do we have a tremendous logistical burden to supply some of these things? And this is going to allow us to both understand our clustering and then eventually our demand management. So you'll be happy to know those were my 3 intense slides. Those are over now. Now I can go into a little bit more of examples of where this is done. So think about a stress in your life, not a shock, but just any stress. And half of the communities that I'll go in, what often happen is traffic is one of those stresses that everybody identifies in their life, certainly in the urban environment. And for some people, traffic doesn't really matter, and they actually take on pride of not being part of the solution, but being part of the problem. In this case, I actually managed to get 2 different cars that have a slightly different license plate, both of which are proud to be global warmers. Sometimes people take the opposite solution and they say, well, I don't want to deal with any of this. I actually want to environmentalize the whole world. And some people just laugh at it. This is actually a game that is called Rush Hour, and you can play that you're in traffic, stuck in traffic all day. But pick on that first example that we were talking about and look at 2 different neighborhoods. The one on the right is my own neighborhood. The one on the left is just an hour north of where I live. On the one on the right, you're able to undertake a whole series of things of your everyday life, live, work, go to school, shop, all within walking distance. On the one on the left, you can't. You're single dependent on a vehicle to be able to do all of those kinds of things. So we can already start to see that with some simple moves, we can even start to build a tremendous amount of redundancy, diversity, flexibility, adaptability within how we plan our communities. So there are communities that are more resilient to those changes. On the one on the left, if something happens to the car, they take away your driver's license, or the car breaks down, or the highway gets plugged, you've lost that resilience. You've lost that ability to continue to operate. So homogeneity, in fact, starts to become a source of vulnerability. Heterogeneity, on the counterpoint, creates a tremendous amount of resilience and diversity in how you operate. So there's a tremendous coincidence already within the ideas of how do we plan communities and how we start to think about complete communities and how do we start to build resilience in those communities. And the confluence of these thinking is what allows us to start to really push the idea even a step further. So how does this actually start to look? Well, we're working currently on in Mississauga and here in Ontario, but it entails that every decision that you start to make in the urban realm, the density of buildings, how they get configured, how they get structured, how they relate to the street, how does it invite people, how does it contribute to a walkable environment. Every one of those decisions starts to contribute to the ability of that community to be resilient, from the small scale to the large scale. And these interventions allow us to deliver a greater vision at the same time as really thinking through where some of those dependencies and vulnerabilities are for communities. And we can go into even the level of the streetscape to really understand some of these things. And I'll give you one example in closing. We're working on the Moncton downtown plan, or we're approached by Moncton. And Moncton, if you don't know, is a city that has really undertaken a tremendous boom and bust over the years. Starting in the 1600s, the Acadians came in, and then the Acadians got kicked out, and then they came back in. And it's gone up and down so much that the city's actually gained its charter, lost its charter, gained its charter again as a city, and has really been subjected to this over time. So they had the vision, and when we started to do this exercise, the vision of a resilient economy, of really trying to level this out. So we started to understand, well, what does this depend upon? Well, that vision of a resilient economy depends on entrepreneurialism, on having a whole series of new business coming into play all the time. That depends on attracting and retaining talent. That in itself depended on having an environment that was going to attract that talent. So very focused, trying to look at that. When we started to look at the conditions in the city, we saw that there was a tremendous set of weaknesses that all collided in the downtown, that this was an area that was particularly vulnerable to the ups and downs in the economy. So it allowed us to be extremely focused, to pick our priorities and be strategic around creating a downtown plan that was very much focused around attracting and retaining talent. And as a result of that, created the plan and started to implement it. And if you looked at Moncton in 1950, it was a fairly well-to-do community. By the year 2000, it was mostly surface parking lots. It was actually quite sad to see. Created the vision and went through an incredibly collaborative process. We had hundreds of people participate in that process, be part of the conversation, go into the details of it. That actually helped in 2005 to have the Rolling Stones come and do a massive concert. It built tremendous confidence in the community. Just so you get a sense, Moncton at that time was 64,000 people. The concert had 80,000 people. It was tremendous. But today, Moncton is the fastest growing city east of Toronto. It's actually one of the 10th fastest growing cities in Canada, and it has had a tremendous amount of activity in the downtown, thousands of new residential units, 4 new hotels, a tremendous amount of activity, and it was because they were tremendously focused and had the ability to really understand what that vision was, what that vision depended upon, and start to build some resilience around the community. So that's my presentation. Thank you very much.